Well, we just had, I thought, a really lively and very informative session about how difficult it is to make changes to the existing system to improve it. And if you think about how hard it is, and you're a commissioner, and you're trying to do something to improve the system, and you reflect on what Harold said, which is if you pull on one thread, you might disrupt the whole fabric. That's really, it makes this disability determination process so difficult. Why is it so difficult? Well, I think there's two parts to it, two underlying structural parts to it. One of them is that we're dealing with a government agency that operates under the old command and control system, like government agencies do through regulations, directives, people carrying out orders that come down that they read in the handbooks and the regulations. And they carry them out, but there's no self-correcting mechanisms when the system goes awry. That's one problem. Another problem is that under the current system, in addition to there being no self-correcting mechanisms, there's nobody that's fighting as an institutional interest in reducing costs or making certain that only the most disabled people receive benefits. That's the law, but there's no actual fighting going on by the business sector, as an example, as they do under insurance policies, medical insurance, and we'll talk about workers' compensation insurance, to reduce costs and improve outcomes. Well, the question then becomes for us, it seems to me, does a system already exist in which the business sector plays a role in reducing costs and improving health outcomes? While it's not a perfect parallel, what we're going to explore in this segment here is how businesses actually operate under an environment of workers' compensation in which they have a self-interest in reducing their costs and improving outcomes. So our first speaker here is Kim Jeanette, the Research Director of the Integrated Benefits Institute. Welcome, Kim.
Thanks for having me. I'm actually going to take kind of a big picture to start, and I am going to look holistically at overall the employer's role in trying to maintain a healthy and productive workforce. The Integrated Benefits Institute has been around about 17 years. It actually started out of research that paired workers' compensation with short-term disability claims and looked at the same people moving in and out of those. Dr. Thomas Perry, who's the president of IBI, did that research about 18 years ago. And from there, launched a nonprofit research organization, Integrated Benefits Institute. We're membership-driven. We have over 700 employer members. And I'm going to present today some of their perspectives, some research we've done, some evidence from others, as well as some evidence from some of the modeling tools we've developed. And I hope it'll sort of lay the groundwork for the great presentations that are going to be coming up on that get more in the details of workers' compensation, because it's a nice parallel of how it can work when employers are really paying attention to preventing and then also to returning to work and accommodating. So let me make sure I can use this. So, you know, I'm going to talk a little bit about sort of the old view, which is probably the predominantly current view of how employers have a role. Our membership tends to be a little bit more leading edge. They tend to be benefits personnel working inside corporations who are trying to actively pursue improved health, wellness, lower disability, lower absence, improved performance, and all the while trying to make the case to their companies about the business value. And that's what's important to employers and important to the C-suite. So what I want to talk about is how employers can have a greater role upstream, so we're not only focused downstream when we've got these chronic, difficult, long-term cases when it's extremely hard to get someone back into the workforce at that point, how we might have more prevention on the front end and how we might have more aggressive return to work and job accommodation in the middle. So we know that our employers are very interested in making the case to their C-suites, to their CFOs and their CEOs about how a healthy workforce can be an engine for the business and for the U.S. economy. This is kind of the old view, you know, let's tweak plan design, let's see what we can do to make sure employees are getting the right kind of health benefits, and then we'll reduce claims costs. And that's just the wrong view. It's part of it, but it's definitely not the big picture. So if we look at the big picture, what we're trying to do is trace a variety of different interventions you can have on the front end, and there's a load that aren't, this is just a schematic. There's EAP programs, there's all sorts of job accommodation that can go on that aren't detailed in here, but are represented by some of the boxes. So when we look at how health conditions can lead directly to absence and lead directly to lower job performance, we're really looking at how might you accommodate the job so somebody can stay in the workforce, have reduced absence because their schedule's been reduced, so maybe they're part-time, have improved performance because what's expected of them for that period of time that they're in a rehabilitation situation, the expectations are lowered so that they can stay in the workforce and not have a short-term disability convert to a long-term disability, which is really when we see the insurance carriers aggressively trying to move them onto Social Security and make sure that they're off the work rolls. We want to keep them on the work rolls. What we do, we spend a lot of time talking to our employer members about what's at risk and doing a lot of research and collecting together the research that many of you in the audience have done and others. We have what we call a knowledge bank that we're launching next month, which pulls together the empirical literature on connecting employee health to disability, absence, and business results, as well as highlighting employer cases. So if you know of any employers out there who have great examples of job accommodation, work accommodation, lowering their disability costs, keeping people employed, we'd love to hear about it and highlight those cases. This is based on a modeling tool we developed that pulled across various data sets we have. We work with about 12 of the major insurance disability carriers in the country who handle short-term disability insurance as well as long-term disability, workers' compensation, and family medical leave. We also pull in group health information from MEPS, the Medical Expenditure Panel, and pharmacy costs. We pull in absence and job performance information from a large HPQ database that we have, Health and Work Performance database that we've worked with Dr. Ron Kessler at Harvard to co-develop that. It's focused on really getting employers to use the HPQ so we can fill that database out for research. What we did is we plugged some information into a calculator we've developed drawing upon all those databases, and we can show what the full cost picture looks like. If we just look at medical and pharmacy, and then we start pulling in some of these other cost dimensions, we can see quite quickly that lost productivity, absence from presenteeism, wage replacement payments, they begin to dwarf just looking at medical costs alone or looking at pharmacy costs. We rely on Dr. Sean Nicholson and Mark Pauly's lost productivity method in terms of computing that. Anyone interested in that, I'm happy to give more information afterward. This is simply a pie chart showing pretty much what you saw in the bar chart, just making the case for really getting beyond a narrow focus. Employers tend to be narrowly focused on healthcare costs. If we want them to have a role on the upstream to try to reduce the bulk of cases that are converting from short-term to long-term or essentially going into the federal system, we need them to focus on more of the holistic big picture about the value of a healthy workforce for reducing absence, for improving job performance, and for having positive business results. It's also good for morale, for employees to see that you can have a disability episode and your employer supports you in getting back into the workforce and making accommodations. We recently produced this infographic based on our modeling tools to just kind of make the case for how important workforce health is to the U.S. economy, drawing upon all those different the costs of claims for short-term disability, for family medical leave in terms of the loss of time when people are out, all of the different cost dimensions that I had mentioned earlier. A lot of research on this. Some of these may look familiar. These are some studies that we published in JOEM. Lots of research out there linking health to productivity outcomes. This was a study we did with multiple employers. These are leading indicators. These are kind of more on the, they're not lagging, so we're not getting all the way to somebody who's who's out of work at this point. These are employees. And so these can become indicators for being able to intervene early on and try to find where you're having problematic cases, where people may be having long episodes of lower performance or lower absence, higher absence. They're absent more. So, you know, somebody had mentioned earlier depression, anxiety, pain. These are the ones that are the big drivers. If we could intervene earlier, get them into the kind of treatment where they could stay on the job and have a work situation like that, they wouldn't be languishing on the rolls, as many. Of course, we know comorbidity really affects lost time as well. In comparing individuals who only have a diagnosis alone of depression or have that diagnosis along with comorbid depression or headache or something else, puts more demands on the medical system, who tends to be siloed into specialty groups, demands a lot of care coordination, making sure that the case manager or whoever is working with the employee to get them through the system is aware of their comorbid conditions, because that can lengthen the amount of time they're on disability. So making sure they're getting the kind of care they need. And then this chart really is just a summary of how different the view is in terms of the leading drivers of cost for an employer if you only look at medical, the first column, than if you include the total cost perspective, the last column. And you're seeing many of the conditions showing up there that have been mentioned already. Again, this is just some more of the research showing the costs. This is really about looking at the big picture, the temporal dimension, being able to intervene early on some of the leading indicators, understanding health risks, understanding early on whether you might have an eventual short-term disability case. When you do, trying to get them into job accommodation, trying to get them in a return-to-work situation, and seeing the disability itself as a lagging indicator. It's an indicator of something that's going on in the system where you may be able to intervene earlier. For any questions, I know I jammed through that fast, but I got my 1-minute warning. Any questions about this? We just did a recent study on family medical leave and how it's a strong indicator of short-term disability incidence and duration, as well as long-term disability. We know that those long-term disability cases just drop out of the workforce. I have that study. If anyone's interested, I can send it to you electronically. But it showed, even for FML denials, strong predictive of a short-term disability claim later on. Thank you.
Thank you, Kim. Thank you very much. Now we're going to hear from Lynn Tatum. Lynn was the former Workers' Compensation Commissioner in the state of Arkansas and did a very good job at finding ways to reduce the workers' compensation costs and improve performance of the system. And later he was, not anymore, he's retired, but later he was the workers' compensation at Tyson's Food. The proper title is Workers' Compensation Director at Tyson's Food. Lynn?
Thank you very much. Here's my slide. If anybody wants it later, they're welcome to it. This is kind of fun. You know, by the way, Dr. Pierce, where is Professor Pierce? He nailed it, man. He nailed it. One of the things, and Jennifer, I've known Jennifer for a number of years. She's never been wrong. But the interesting thing, I haven't heard, maybe it was last time, do we look at, or is anyone focusing on the number of people who are put into the disability class and out of the workforce because they're addicted to prescription drugs? I mean, that's something that we're seeing a lot in workers' comp. But anyway, let me start over. Actually, I am retired. I'm no longer running Tyson's workers' comp program. I enjoyed it when I did it. It was very successful. We saved a lot of money. A good safety program and a good return-to-work program is very effective, and it's the only way to save money in workers' comp. Let me say this about greedy employers. Employers spend a lot of money recruiting and training people, and when they're lost to them in any capacity, it is expensive for an employer, greedy that they are, if you have that mindset, to go out and hire someone else, recruit them, train them, and you're losing productivity. So bear that in mind. There's a huge cost, and Dr. Jeanette alluded to it. There's a huge cost, not just the loss of productivity. I will say on the front end that I am an attorney, a recovering attorney actually. I'm in a 13-step program. But Jason said to me, where are the signs? Jason said, you can't tell everyone everything you know about workers' comp in 10 minutes, but I probably can. Actually, during my 40 years of working in the workers' comp field, as an attorney, I represented both plaintiffs and defendants in workers' comp cases, not in the same one, by the way. But as the workers' comp commissioner in Arkansas, I was involved in drafting major workers' comp reform in 1992. And since that time, in every year since 1992, NCCI has filed for a rate decrease. Our cost of workers' comp has gone down every year since 1992. Benefits to employees, the weekly benefits to employees have gone up every year since 1992. How does that work? Well, first of all, we reduce litigation, and second, we really emphasize return to work. And if you think, and Professor Pierce talked about the attorneys, believe me, an attorney can script a bowling ball. You teach them how in law school, but what they also understand is how to spend their money lobbying. If you try to change this system, the Social Security Disability, that's going to impact the income of the TV lawyers that are out here every day advertising, spending that money. They'll spend that money on lobbying their legislators. We see it in every state. One thing I'm doing right now is working with a group in Tennessee and a group in Oklahoma to try to change their workers' comp law. Just passed in Tennessee. The lawyers ran TV ads, full paper newspaper ads. They were really unhappy, so it's probably going to be a good law. In Oklahoma, the reason Oklahoma was really interested is because Oklahoma has the 6th highest workers' comp cost in the country. Arkansas's got the 49th. And remember, our weekly benefits have gone up every year. So Oklahoma thought, well, maybe there's something across the river that would be helpful to us. And so we've been working with them. I have 3 minutes left. Okay. I'll talk even faster. What I have learned is that workers' comp is very simple. It really is simple. What you do is either prevent the injury from happening at all, spend that money, or you put people back to work. It's the only way you're going to save money. You put people back to work. Why does that not work in every state? Because many states are more litigious. When you see 95% of the cases litigated in a no-fault system, something's wrong with that problem. That's a major problem, and until you cure that, you're not going to be able to. It's one of the impediments for the system working, and it's one of the impediments, big impediment, to return to work. So that anything you put between the employer and the employee in return to work is going to be an impediment in return to work, and oftentimes it's the bureaucratic state agency. Can you say that Social Security is bureaucratic? Probably so. The question I'm supposed to talk about is the interaction between state workers' comp agencies and employers with regard to SSDI. There is none. The one thing we know is that if someone who is on workers' compensation applies for and receives Social Security disability insurance, they're not going back to work. That's just that simple. And why? We can talk about that, but it is a matter of fact. And so is there room for improvement? You bet there is. Is it going to be hard? You bet it is. And if you want to see how hard it's going to be, you try to change it and see what happens to the lawyers that are making all this money in it. We see it in state after state in trying to change workers' comp law. How am I doing? Thanks.
Thank you so much. Now we're going to hear from Mark Skinner. Mark is the executive director of the, he's a senior consultant for the Workers' Compensation Research Institute, which does work on the issue of workers' compensation. Thank you and welcome, Mark.
Well, so thank you very much. I'm not the executive director. Rick Victor, our executive director, was scheduled to be here. He was unable to be here. WCRI is a Boston-based Cambridge research organization, nonprofit organization. We attempt to provide objective, independent information to aid policymakers in making informed decisions about the workers' comp system. We don't take positions on our research, but rather hope to engage in a dialogue with you on it. So I'm going to talk about two things, I guess in two parts. First, a little bit of background about the workers' comp system so you can understand a few distinctions between workers' comp and SSDI, and then hopefully to give you a few lessons or examples of where the workers' compensation system might inform some of your thought processes going forward, and then close with maybe a couple examples of state systems that are doing some innovative things. So first of all, workers' compensation is a state-based program that is mandated in most states for all employers to provide insurance or to self-insure their employers in their workplace injuries. It's a system that's been around for over 100 years, and it was originally developed as a replacement for the tort system so that it creates a non-adversarial system that really allows to focus on the injured worker. It is a state-based system, so every state is different. There's 50 different workers' compensation systems, and one of the great things about that is that it then actually becomes a laboratory for experimentation or innovation in the state systems and has some flexibility to actually evolve. When we also think about workers' compensation, it's interesting to think about the actual case mix that makes up what the workers' compensation claims are. 80% of the claims in the workers' compensation system are actually claims that involve less than 1 week of lost time from the workplace, in contrast to SSDI, which is long-term. About 25% of the cases are less than 1 year, and 5% are only 1 year or more. So in most cases, SSDI tends to be for those that are disabled for 1 year or longer. So a significant difference in terms of case mix when you're making the comparison. There is a small potential for some overlap and for some lessons learned. But to put this in context even further, understanding the types of cases and claims that evolve within a workers' compensation system, there's really three areas. There's the basic trauma cases, which would involve fractures and lacerations, which typically would be very of short duration, and the worker would return to their pre-injury employment. Thank goodness, the number of cases that are actually catastrophic and involve long-term disability are in fact relatively small. Those might be comparable to the SSDI system. There are the strains and sprains types of cases, which might have a more long-term or lingering impact. But the key feature of the workers' compensation system to deal with those is it allows a timely, and timely is a key word that you'll hear me repeat, and appropriate care in a rapid basis to avoid and alleviate the long-term consequences of being lost to a disability system. Perhaps the greater area of comparison would be those of the chronic or the long-term cases. The more difficult cases, the cases that become more subjective, particularly as they relate to psychosocial factors and other return-to-work decisions that make it very difficult to actually tease out the nature of the disability. And those might be of an interesting analogy to return to work. Again, within the workers' compensation system, one of the unique features about workers' compensation is that it is a blended system where the employer has the responsibility to address not only the indemnity or the wage loss of the injured worker, but also the medical care. And it allows these two systems to actually work in harmony to achieve return to work. On the medical care side, unlike other reimbursement systems, there is a great deal of flexibility where the employer or the insurer that's administering the claim on behalf of the employer has the ability to deploy those resources in the medical care that is necessary without any deductions or co-payments on the part of the worker. There's the flexibility really to tailor that return to work program or case management program for the worker. The income benefits are typically around 2/3 of the employer's weekly wage. They're often typically tax-free. If there is a residual physical disability after the employee has returned to work, there is in many states a lump sum payment to that worker, and then at the point of that lump sum payment, it actually ends the employer's obligation for long-term payments to that injured worker. In the few cases where there is a permanent total disability, where the employee is not able to return to work, then the wage loss provisions would continue typically in most states till around the age of 65 when they'd be transitioned to another system. Fortunately, again, the permanent total disability cases really are about less than 1% of the total workers' compensation claims and are often the catastrophic cases. So that would be in comparison to SSDI, so in terms of a long-term nature. So in terms of lessons from the workers' compensation system, I'm going to talk about three. The return to work incentives for the employer really are based on speedy, timely intervention, and something that is sustainable in terms of return to work for the employee. The economic incentives and the alignment of the economic incentives for the employer to support the return to work of that injured worker are certainly paramount. The workers' compensation premiums are merit rated, so what the employer pays for their workers' compensation insurance is really based on their ability to return the injured workers to the workplace. So the faster that you return to work, the lower your insurance premiums in general are going to be. The employer pays the income benefits for the injured worker during the time that they are out of work. And so again, the faster that you return to work, the lower the income benefits are going to be. The employer pays the cost of the medical care. And so the medical care can be deployed with a return to work incentive, and so that it's tailored, it's in fact appropriate. If you analogize that to SSDI, where SSDI and Medicare are two separate programs, you can quickly see the inability to actually achieve a good harmonization or coordination between the two programs to actually promote that unified administration and that timely return to work. The workers' compensation system, one of the hallmarks really is the integration of all of the aspects so that you really are focused on what is best for the injured worker. The second lesson from the workers' compensation arena is that of case management. There have been a number of firms which actually have developed to specialize in actually managing and looking after that individual patient in a one-on-one basis. As opposed to being lost within the system, the injured worker actually can move into case management, and often irregardless of strict insurance policy rules. There is a lot of flexibility to actually focus upon the system, and the system is again designed to encourage that early intervention, focusing on what is appropriate for the injured worker. So employers may have the option or the necessity to spend more on non-traditional care. They're not necessarily going to be bound by strict rules in terms of what's reasonably necessary. And the lag time is, in fact, particularly important, that once an individual is lost to SSDI, they often don't come back. The last is the selection of treating providers. And the workers' compensation in this system, on average, actually focuses where the employer has the ability to select the treating physician. We find that the costs are very similar to those where the injured worker sees their family physician. When they see someone else, often the costs are higher. So systems that allow that management. Very briefly, in the interest of time, I just want to mention two closing scenarios. The first is that there, again, are specialty firms that focus at catastrophic injuries, and they now essentially, for a fixed fee, will take over that case management to work on return to work. So there's a clear economic incentive for the organization doing the work, as well as for the employer, again, to focus on that return to work, aligning economic incentives. And the other, and the last one I will mention, is the Preferred Worker Program in Oregon, which actually creates economic incentives for the employer. It's a state program funded by employers where they actually receive economic benefits, both in terms of salary support as well as workplace accommodation, to actually create those incentives, again, to align the economic incentives to encourage the rehiring of employees. And I will stop there. Thank you.
Thank you very much, Mark. Our last speaker before we open for questions is Jill Houghton. She is the Executive Director of the U.S. Business Network. Jill?
Okay. Yeah. Good morning. My name is Jill Houghton. I'm the Executive Director of the U.S. Business Leadership Network. We are a national, nonprofit, nonpartisan, business-to-business network that is focused on leveraging disability inclusion in the workplace, in the marketplace, and in the supply chain. I'm here today representing our corporate members who, you know, like, never in my lifetime did I think that we were going to be here, but corporate America wants to hire, wants to retain employees with disabilities. And there is a fire going on out there right now of businesses that are teaching each other about the importance and the value that workers with disabilities bring to the workplace. While our members are not experts on Social Security programs whatsoever at all, we do believe that as a nation, that it is important that our current system needs to be rooted in one that's focused on talent, and that we need to move towards focusing on a talent model and move away from looking at people with disabilities through the medical lens and focusing on what people can't do. There are senior corporate leaders out there like my board chair, Keith Wiedenkeller. He's the Chief People Officer for AMC Entertainment, and they have launched a national initiative throughout their whole corporation to recruit and hire people with disabilities. And there are countless companies out there that are learning from each other about the importance of this market. But let me tell you something. There's a question that we hear every single day over and over and over, and it is, where is the talent? Where are they? Where are people with disabilities? We want to hire them. And so I'll tell you, in response to that, we created a National Student Advisory Council of kids. They're rock stars. These kids are awesome. They're like Jimmy Curran, just graduated from Temple with a degree in finance, with honors. He has multiple disabilities. And let me tell you what these kids are facing. They're facing the challenges that you all have been talking about, that we continue to talk about, that there are barriers out there that are causing them to either not be able to enter the workforce or to join the workforce but have to stay really poor so that they can get the supports that they need in order to work. These are kids that have fought long and hard to be included. They're in college right now. They're graduating from college right now, and they want to be part of the workforce. And our corporate members want access to this talent, but there's a problem, and it's not easy how we're going to get there. But our members want access to this talent. We represent the demand side of the equation. We need the talents. We need the dedication, and we need the creativity that people with disabilities bring to the workplace. Equally important, we want policies, programs, and investments that support the paradigm shift from a medical model to a social model and focus on the talents that meet businesses' needs. Thank you.
Okay, we have time for questions. Those who are, Lynn, why don't you move up front, wherever you are? You're right here, okay. Yes, go ahead, sir.
I'm Brendan O'Connell with the Florida Bar, and you're absolutely right. We are so expensive because of the adversary system. But my question is directly to you, Lynn. With your drug-dependent injured individual, do you know of any jurisdictions where it's mandatory to give rehabilitation to those same individuals?
Lynn, you're going to either have to go here, or who's got the mic?
I doubt if I need a mic.
All right.
The answer to your question is no, but my real suggestion would be that we rehabilitate the doctors that are giving the prescriptions to these folks. You know, my back hurts. You performed a perfect surgery, and why are you in here complaining? Here, take OxyContin. And guess what? You know, your back may not hurt anymore until you run out of OxyContin, and then you want some more. And so you're going to hurt some more. I mean, that's an oversimplification, right? But it's a fact. We see it all the time. I think the federal government has figured out that they're spending a lot of money on these people that are now addicted to prescription drugs. So I think probably some solutions will appear, but not in workers' comp yet. It's a huge problem.
Yes, who else? I'm going to, you go ahead first, and
So this question is for Jill. Could you elaborate a little bit more on the student panel observation that they have to stay poor to get supports? Is that a reference to SSI, or is that a reference to having to use social systems, or could you elaborate?
So I'll give you an example of one of the students, Jimmy Curran, okay? Went to Temple, graduated with a degree in finance, is an individual that was born with multiple disabilities, okay? He got a job as a market research analyst at a Blue Cross Blue Shield affiliate in Philadelphia. He was on SSI and used Medicaid for personal care assistance services, all right? Didn't know about 1619B. With our assistance and, getting him the right information, learned about it, is working, is right up there at the level, right? Is getting ready to become dually eligible, still needs those personal care assistance services, wants to work. What is he going to do?
Jill, I just had a question. You were mentioning that businesses are very interested in hiring people with disabilities in the United States, but in this area, in DC, Maryland, Virginia, I see that there are a lot of people with disabilities that don't have jobs. A lot of people who are deaf, like I am. The federal government is very friendly to with people with disabilities, but corporations and businesses are not seen as so. And so often it's a communication barrier, specifically with people with disabilities. People don't want to pay for accommodations such as interpreters because of the quote-unquote burden of paying for interpreters.
So I think things are changing. Definitely we have a long ways to go, but at the USBLN, we're working with business at the national level, as well as we have over 50 affiliates across the nation who represent more than 5,000 businesses who are looking to recruit and hire people with disabilities. And they're anxious to find people with disabilities. Now, it's not a true love story, right? We've got a long ways to go. But what I'm here to tell you is that for a whole host of reasons, because corporate America is standing up and speaking out on this and teaching each other, things are changing. And also, I think a lot of companies are coming out of the woodworks because they see the proposed 503 regs from labor. And they're coming to our organization and they're saying, okay, I want to be really honest with you. We haven't done anything in this area, but we want to start. And that's, we're the right place to come for that.
Mark, I would like to ask you this question. You talked about workers' compensation and its characteristics of speedy, timely intervention and the economic incentives that are in alignment with health. One of the reasons you pointed out you cannot always use workers' compensation as a way to learn in these other systems is that it deals with short-term and minor events. But you mentioned that there's now firms that deal with the catastrophic in both long-term disability, if I understood it, incorporating back to work efforts in case management. Can you elaborate on that and let us tell us if there's any further things we can learn from that?
Thanks. So I think the most notable example was what I was starting to summarize at the end of my previous talk, which is the Oregon Preferred Worker Program, which is all of the employers in Oregon contribute to it as a part of the state workers' compensation program. Employers are then encouraged, an injured worker who is not able to return to work gets a preferred employee identification card, and then is allowed to go to, I think it's 2 different employers, so there can be sort of successive employment, to where that hiring employer actually receives a 50% salary credit for a period of time, which I believe initially is up to 6 months, and then there is a retraining or physical modification provision for compensation to the employer if they need to make necessary accommodations. So there is a clear incentive for the employer to actually provide that work, as well as there's a number of economic incentives to the employee, again trying to create that culture of intersection. In terms of case management, I think it's a relatively new area. It's a group by the name of Paradigm, which I was actually thinking of earlier, which will sort of take a bundled case and then actually work with that employee on an ongoing basis to manage the full set of their work. And since they're doing it for a fixed fee, there's certainly an incentive for them to complete their work and return to work, but they have an obligation to stick with that employee over the duration of time. So it's aligning the economic incentives with the specific needs of the individual employee, both through one example of a state program as well as in the private sector.
Of someone who's had a major, been hit by a car or multiple trauma, that's who Paradigm will take. But if you talk to a workers' compensation insurer, particularly a reinsurer that's only handling claims that are costing north of $250,000 or $500,000, they'll tell you the vast bulk of what is in their inventory is people with low back pain and the common health conditions I was telling you about. The workers' compensation system isn't terrific at dealing with these either, because what we have, just like we have a lot of variability among the ALJs, we have a lot of variability among the way that doctors handle people with low back pain and by complicated social circumstances, and also the way that employers handle them. And it is the response by the doctor and the employer to a common health condition that determines whether it turns into a creeping catastrophe or not. And if you weren't here on last Friday, please Google Arthur Boorman, A-R-T-H-U-R-B-O-O-R-M-A-N. It's the case of a former paratrooper who was basically disabled by the medical system. He doesn't ever say it, you just infer it. And then you watch the guy rehabilitate himself because he decides the healthcare system hasn't delivered him the future and the life he wants. And it is just a powerful, powerful statement of what is possible for people who look hopeless and are on the disability rolls now.
Other questions? And I would like our 5 secretaries here to think of a question they might like to ask to enliven our discussion. Yes, go right ahead. You're done.
I'm just admiring your time.
Oh, okay. Who else has a question? Eloise, Mora?
I just have one question, and that was when Jill had said that the barriers, and then she gave an example, and the example sounded like the cliff to me, but she didn't say what it was, and then she didn't talk about what the other barriers were to people with disabilities, and if it is the cliff, then I think she should tell us what that cliff is.
In that particular story, in that particular individual, one of the most important things that he needs is personal care assistance services. And he receives those through Medicaid. And if he loses his Medicaid eligibility, he will lose his personal care assistance services. And that's how he gets out of bed in the morning and eats and all of that good stuff.
Just to follow up on that question, is there any mood or interest at all in this? I don't mean to put you on the spot,
okay,
to be fair, but just since you're the most knowledgeable person about what's going on in businesses here today. Is there any mood in the private sector as they look at the benefit plans that they offer? I mean, for example, some offer child care, and they offer a variety of transportation subsidies, different things to employ, not everyone across the board. But has there been any mood to consider
personal care services for people with disabilities, or is anyone really on the cutting edge of that idea?
Ironically, we received a question from a member on that topic within the last couple of weeks, who was doing some research in that area.
I want to go back to my cliff issue. I think that many of our programs don't just affect people with disabilities, but I know of quite a few people who will not get, they don't want raises, they won't take certain jobs, and there's nothing wrong with them, they're not on disability, and they won't do that because they will lose their Medicaid. So I think we have put really negative incentives, not just for the disabled, for a whole lot of able people to work and advance.
And let me just say that on that point, then if you're a business who is invested in recruiting and hiring this candidate, and you want this individual, you put all that expense in, and you want this individual to grow with your company and advance, and that person is going to either not be able to grow and advance, or in fact to have to leave the workforce, then as a business, there is an expense as well.
We have time for one more, I think. Hearing none, thank you very much, panelists. We enjoyed your remarks.